My name is Beth. I'm a speech and language pathologist, and I wanted to pop in today to talk about an expressive aphasia treatment. This treatment is called Response Elaboration Training. So it doesn't take a ton of preparation, so to speak. I mean, definitely you want to have a plan, but let me tell you what's involved. As a clinician, you should have specific RET or response elaboration training goals for your client or for your patient. You can do response elaboration training with pictures. You can do it with auditory prompts. So you do need to have thought behind, for sure, which types of pictures or auditory prompts you'll be choosing for your specific patient. The purpose of this treatment is to help your patients with aphasia or your clients with aphasia to have more content words in everyday conversation. So if family members are tuning in, or even caregivers or even patients, these are things that you can also try to do at home. I would, check with your speech pathologist to see if response elaboration training is appropriate, if they're doing it with your loved one, or if you are the one with aphasia, if that's what you're doing, and then ask, what kinds of pictures or prompts or things can we do at home. So when I say content words for everyday conversation, where I'm talking about nouns, adjectives, verbs, prepositions, pronouns, all of those types of words. In this type of therapy, we are following the client or the patient's lead. I'm going to show you an example of a picture that you can use, or that a speech pathologist might use. A lot of times we use pictures of everyday experiences because, again, these are for everyday conversations. So let's say we show the individual or client or patient with aphasia a picture of a woman doing laundry. That's an everyday activity. So we would show the picture and we would say, tell me everything you can about this picture. And if their response is woman doing laundry or woman laundry, then as a clinician or speech pathologist or a family member, we would say that's correct. A woman is doing laundry. And I might ask a WH question, like who, what, where, when question, to try to elicit more of a response from the individual or from the patient or client. For example, I might say, what is she using to do the laundry or to wash her clothes? Then they might say laundry machine or washer, and you would be very positive and say, yes, that's right. She's using a washer or a laundry machine to do her laundry. Can you repeat that in a complete sentence? She is using a washing machine to do her laundry. And then you're going to keep asking questions about that picture, and you should try to ask about at least 10 questions, so to get at least 10 responses. So remember, your goal, or the goal, is for the patient or the client, the person with aphasia, to produce as many content words as possible. So nouns, verbs, adjectives, pronouns, prepositions. Putting her laundry in the machine could be a prepositional phrase as a pronoun. So before I go any further, another thing that we have to remember is that these are usually the patients or the people that I work with that have aphasia are adults. So I work with children and adults. And so we have to remember, even when we're giving like positive responses during something like this type of therapy, these are adults and not children. These are adults who had a stroke or a brain injury, something very significant happened with their brain that is causing them to have difficulty talking, speaking, sometimes understanding. And these are skills that they used to have. And this is something that could happen to you or me or anyone. And we definitely want to make sure that we are not talking to them, even when we're giving positive response or positive feedback, as we would, when we do that with our younger clients. These are smart individuals who used to be able to speak, and now this has happened to them, and so we just have to keep that in mind. When we choose a picture, we want to choose a simple picture, typically, an everyday, or, if that individual likes to golf, maybe Maybe it could be a golfing picture. I mean, in everyday activities or even just an interest that that patient has, we want a picture that is pretty simple and definitely has an action, a verb, action word, so that the patient can also practice saying the verbs in addition to nouns and adjectives. Okay, so take a look at this picture. So this is a good one. It kind of has a lot in the background, but she's doing a simple action. So if you had a patient that likes to cook or likes to bake, you could use this one. It's a everyday activity. She's dressed a little fancier than I would dress if I was baking or cooking, but that's okay. So it has a verb. So tell me everything that you can about this picture. So if the patient says she rolling, or she is rolling, or she's baking, you could say, that's right, she is rolling the dough, or she is rolling out the dough, or she is baking dough. Then you can ask more pictures so we can get like, oh, what is she using to roll out the dough? And so then you would hopefully get, oh, a rolling pin. And then we could say, yes, that's right. Let's put it in a complete sentence. She is rolling the dough with a rolling pin. So that's an example for that picture. I really like this one because I like being outside. So maybe you have someone who loves to camp or hike or whatever, and they were a big camper before their stroke. It's a motivational picture for them. It's an interest. So you could say again, tell me everything you can about this picture. And then if they said he's fire or starting fire or whatever they say, then you can elaborate it. That's right. He is starting a fire. And then you can keep asking more questions. Like, where is he starting the fire? And, he is starting the fire in the woods. So those are just some quick examples. So we also have auditory prompts that we can use for this type of therapy. We use auditory prompts. It's called modified response elaboration therapy. So it's M-RET. For this one, you want to use like multi-step tasks that your patient or client may do, just a functional task or whatever they might do on a daily basis. And then you're going to ask them to describe how to do what they're doing. Hobby, it could be a chore, it could be something that they would do at work. Go back to that laundry one that I did in the beginning. That was the first example that I gave you for using pictures. You could ask them, tell them, please describe how you do your laundry, like in detail. Give me the steps that you would do to do your laundry. So, so your patient might then start to give you the steps of how they do their laundry. So they might say something like, I sort my laundry dark and light. I put them in the washing machine, and then I put them in the dryer. Again, you're going to give them a positive response and say, yep, that's right. Can you pretend that I've never done laundry before, ever in my whole life? Give me a little bit more detail and kind of explain how you do those steps that you just told me. So make sure you give your patient or your client time to respond, extra time. Give them more time to come up with a more detailed response. They might then be able to say, okay, well, I put my laundry in 2 baskets, light and dark. Then I put them in the washer and I use soap. I turn the machine on, turn on the dryer, and I dry them. Then you can just say, awesome. Is there anything else? And then that may prompt them to give even more detail and practice even more. Would allow them to hopefully practice more of those content words. So those nouns, verbs, adjectives, pronouns, prepositions. You can do it, you can repeat it and with auditory prompts, like those auditory prompts that you're giving. You can even do it while somebody's doing the activity. That might also be helpful, and they can talk out the steps. And you can still ask the same questions and see if they can give you more detail. So just quickly, when you're doing the auditory feedback, some of the functional examples that you could do, we did laundry, could do going to the grocery store, buying food, feeding your dog or your cat, taking your medicine, watering your garden if they're a gardener, starting a fire if they are a camper, or packing for a hiking trip. So if you're a speech pathologist, some goals that you might be able to write or target for RET or response elaboration training with picture prompts be something like patient will generate 5 sentences or a specific amount of nouns, verbs, adjectives when presented with a pictured scene, such and such cues with such and such accuracy. Or it could be something like patient will generate 2+ sentences or 2 or more sentences with 7 or more words, response to a visual prompt or visual scene, given such and such cueing with such and such accuracy. And you can do the same goals for auditory prompting, and except in that case you wouldn't say given visual scene or visual cues, you would say given an auditory prompt. So this was just a brief sort of explanation with hopefully a few helpful examples of how you would carry out response elaboration training and then modified response elaboration training with the auditory prompts. So guys, if you have any questions or if I missed anything or you guys have additional information that you can offer to me or other speech pathologists or even families or patients with aphasia, please put some comments in. And if you like this video, please like it and subscribe and let me know what else I can do to help as much as I can. All right, thanks guys, take care.